Good evening, everyone. We're going to give everyone a couple minutes to get signed in, and we'll get started here shortly. Looks like everyone's in, so we'll go ahead and get started. Good evening, everyone. Thank you for joining us. We're excited to welcome you to tonight's webinar, How XTRAC Can Benefit Your Patients Clinically and Your Practice Financially. Tonight's webinar will run for about an hour, and we'll leave time at the end for a Q&A session, so feel free to drop questions in the Zoom Q&A box throughout the presentation. I'm pleased to introduce your speaker, Dr. Michael Nazareth, a board-certified dermatologist and president at Western New York Dermatology and a longtime XTRAC provider. Dr. Nazareth will be walking us through the clinical value of XTRAC, sharing real-world insights on patient outcomes, and discussing the financial impact it can have on dermatology practice. And with that, I'll turn it over to Dr. Nazareth. And Dr. Nazareth, before we jump into the presentation, could you please begin with a brief introduction, your background, your practice, and your experience with the XTRAC excimer laser?
Absolutely, Jake. Thanks for inviting me to give this talk today. For everybody joining, I really appreciate your attendance. I am here to take your questions too, so obviously, please feel free to ask questions as we go here. We started with XTRAC back in 2017. Phototherapy has been out for a long time. We wanted a little bit more targeted approach for our patients, and we're looking into excimer lasers and talk to STRATA. And I really believed in the model that they set forth. And I'm going to go through why that works for my practice so well. We started kind of small. We were doing just a few treatments a week initially. Now my practice does 50 plus treatments a week with this device. We actually even have a second device in the office now because at peak hours, we're using, both machines. So we've really grown a lot in the past 7 years, 8 years with STRATA here. And I really do feel that as my practice continues to grow, this becomes a more important device for us because even though the treatment landscape really, since we started using this, has exploded for atopic dermatitis, psoriasis, and less so for vitiligo, obviously. But this has become a wonderful treatment for those patients, even in conjunction with many of the other new therapies that we still have. So I know a lot of people were concerned that as new therapies got developed, would we still need something like this? And honestly, it's become even more valuable as we've gone forward. And hopefully I can kind of walk you through that tonight to see not only how it benefits patients, but how it also helps our practice to bring in some ancillary revenue and also to make our patients more happy and make our other treatments actually work better. So as you can see here, we've been using this now for over 9 years. We've treated thousands of patients with this device. And that's across the indications for psoriasis, which is probably our number one, followed by atopic dermatitis and vitiligo. So briefly here, just to introduce you, this is what the machine looks like. It is a 308 nanometer excimer laser. It is FDA cleared for the treatment of psoriasis, vitiligo, and atopic dermatitis and leukoderma. And the key here, unlike some lasers where you're concerned about different skin types, this is safe for use in all skin types, including your high Fitzpatrick patients. There is a very large patient base that this applies to, in our opinion, obviously. Psoriasis, vitiligo, and atopic dermatitis are some of the most common inflammatory skin conditions that we see. I was doing some rough math on this just to figure out, and overall in the United States, there's about 10% of the entire US population. So we're talking probably in the range of, maybe 27 to 35 million people in the United States who have at least one of these diseases. So obviously out of those, atopic derm is probably the biggest one, sitting in that 25 million range. Psoriasis is around 8 million, and vitiligo is around 3 million. So there are millions of these patients out there. And I'm sure there's hundreds, if not thousands, walking into your office with these conditions every day. So I do think there's this huge opportunity and an unmet need for these patients to have a therapy like this, which we can use independently or in conjunction with other therapeutics. It is clinically proven, safe and effective treatment. It is covered well by insurance, minimal to no financial burden on patients, and there is a copay assistance type program, which I will get into later. The sessions are very quick, comfortable, and non-invasive. So these become wonderful treatments even for pediatric patients because they can tolerate them very easily. Again, conjunctive use really is becoming the key now. We can use this in conjunction with our topical treatments, but also with oral molecules and biologics. So we do combine this with other treatment modalities. There are dedicated CPT codes for our XTRAC machines here. So 969, 20, 21, and 22 are the main ones here, and those are broken down based on surface area, and that is used for psoriasis. So the push is there to actually get these to be specific for excimer lasers, so that these are also the codes for atopic derm and vitiligo. And some of our insurers actually do still use those codes for atopic derm and vitiligo. Others look at those as unlisted or special dermatologic service 96999. So some of our vitiligos do get billed under that code. But again, the vast majority of what my office is billing is 96920, 21, and 22, which correspond to the codes that you're acquiring from STRATA for C1, C2, and C3. The reimbursement support program really is critical to this, and this is what helps you actually get patients on treatment. We are uploading the patient's information into this RDX portal. It is then STRATA that is completing the prior authorizations to get it approved and investigating the insurance and appropriate billing codes that we would need to use. They then update the portal, and as soon as we see that a patient is approved, we call them and get them scheduled as soon as we see that approval go through. Their team is wonderful about getting this done, so the turnaround time is pretty quick, which I do feel is important, right? Because if there's too much lag there, or it takes too long to get the prior auth, you lose the momentum of getting patients on treatment. So it is important that that gets turned around quickly, and they have a really dedicated, wonderful team doing that, which our practice can reach easily if we need help with that process too. The partnership program here is kind of what separated in my practice this excimer laser from others, right? Because we could have just bought an excimer laser machine and tried to fight insurance and do everything on our own and maintain our machine ourselves. But this was a much better model for us because really it is all encompassing of the entire journey from making the decision that you want to have this in your practice to actually maximizing its use and doing it safely with really good training. So practice development support is key here. STRATA does a lot of help with the marketing and developing your practice to really optimize this. The patient rebate coupons are great too because patients are concerned. Some patients have copays. So many insurances will approve without a copay. Some require a copay. There's a patient rebate coupon. I believe it's after they do a certain number of treatments. The patients can fill out this form and get those copays back. So it really minimizes the financial burden to patients. Field support service is absolutely critical because if your machine goes down or needs a gas exchange or something like that, if you have your own device and you don't have a company like STRATA behind you, this can be a big lag in getting your device back up and running. Here, they're seeing these things in real time, coming out to our offices quickly. If there's a problem, they try and get here right away. So we really don't run into a lot of downtime, if any, with these machines, so that we get those patients treated and we continue those treatment courses, which means no lag in treatments and then obviously no lag in revenue for the practice too. Likewise, one thing that happens when we buy lasers, because I have a large spa that I run as part of my practice, we have a lot of lasers here. It always happens that, you have this latest, greatest device that you just bought, and 2 years later, something else comes out and now makes that device obsolete, or the new one's faster or better, or in some other way, shape, or form you really want it. Here, when there's new devices that come out, STRATA will swap those devices into your office. So clearly, we've been with them now for 9 years. I think we're probably on our third generation of laser during that time. And these ones are the fastest and the most efficacious compared to the excimer machines that we started with when we first started with STRATA about 9 years ago. So that's been a huge benefit in terms of actually helping with that process there in general. Others, consumables and parts, if things break on the machine, they're taking care of that. The DTC campaigns that STRATA has run have been really great too, because they drive patients to your office. Some patients see those ads and call the number, and then therefore STRATA is actually referring them to your office based on zip code and where they're located. You still need to do an assessment on these patients. Just don't, we're not just booking an appointment. We're actually seeing those patients and determining if this is the right treatment for them and making sure it is their diagnosis that fits one of these three to make sure this is going to work for them. The reimbursement support obviously has been there. And then the last one I want to touch on is the clinical support and training, because not only is the device there, but you need somebody who's now going to operate the device and do it well and follow the treatment protocols. So STRATA sends their team in to actually train the staff to do this treatment. And also with the other development support too, like how to answer the phone call, how to make sure patients are aware of this. So they come in, train our nurses. I will tell you, after the pandemic and with that whole process that we went through, we had a lot of turnover in our nursing staff and things like that. They were wonderful about getting their staff out here to train new nurses as they came in. Thankfully, now we're in a place of much better stability in my nursing staff. And it is my nurses who are doing these treatments. So they make sure that they're very well trained. They run in services from time to time to make sure that they're doing it as best as possible and optimizing treatment and doing it correctly. So I really do feel that that has been huge in making sure that these treatments are getting done the right way and our patients are getting the best outcomes and following treatment protocols. So, we've covered that. Now, who are the ideal patients that really should be treated here? So I'm going to start with psoriasis. It really is effective for all kinds of psoriasis, but it's really nice for those recalcitrant spots. Like, you've got some patients who do well on topicals, or maybe they're even doing well on a biologic. But remember, even with most biologics, we talk about PASI 90. There's still those little breakthrough areas, or there's recalcitrant areas, or, me living in Buffalo at this time of the year, we are getting people who are really flaring up due to the weather and things like that. And sometimes they're staying mostly clear on their biologic, but they still get those flare-up areas. So, scalps, knees, elbows, palmoplantar, nails, ears, nape of neck, those types of things works really well. It also works really well for inverse psoriasis and sensitive body areas. So, we've treated underarms and groins and things like that with this device very effectively. I particularly want to call your attention, though, to scalp, because a lot of people think, well, how's that going to work in the hair? We basically comb a layer over at a time and then fire down that row. The training staff are really wonderful at showing nurses how to do that effectively. This has been a really great treatment for scalp psoriasis and palmoplantar, which notoriously have been very difficult to treat and probably some of the most difficult types of psoriasis to treat, even with biologics. Nail is another big one too. We see a lot of patients with nail disease, and traditionally that has forced patients to go to systemic medications like methotrexate or biologics, when even sometimes they might not want to have to go that route, just because we can't do creams in those areas effectively, and we're not doing intralesional Kenalog injections. Those are very painful into nail beds. So this treatment has been great for treating nails for psoriasis, and it's made patients very happy because the laser will penetrate into the matrix in the nail bed. So for vitiligo, it can be used anywhere on the body. It is best for new onset areas, not areas that have been present for many years. And it works best probably on face, neck, and upper chest. Not quite as effective for some of the bony prominences overall that we see. But overall, I would say we get the best results on face. And atopic dermatitis, really great in terms of the pruritus, but also really clearing certain areas that can be tough. Knees, elbows, skin folds, creases of palms and soles. People with dyshydrotic eczema on the hands and feet, where normally those can be very difficult to control with topicals, or the topicals are just getting too messy for patients to tolerate. This has become an excellent treatment. Figure that it's about suitable for treating about 10% body surface area, with 1% being roughly the size of your hand. That's big for us because we see a lot of patients on biologics who get to about 90% clear, even 95% clear. And most patients don't get to 100% clear. So before, those are areas that patients now are just kind of using creams on and off or just living with. Now we've got a treatment to even clear up those areas to try and get our patients to, 100% clearance with some of these diseases. And for vitiligo patients where, it gets a little bit more difficult because we're probably not going to clear all the areas over the bony prominences, I would say that it's really great for clearing the face, which is the most vexing area for our patients. And we often combine it with Opzelura for those areas, but very, very effective treatment overall. As I mentioned, conjunctive therapy is possible even when they're actually on therapy. So obviously, this becomes something you can do right out of the gate because generally this is going to get approved before they're biologic. So while you're waiting for insurance benefit or treatment results, wonderful to start it. But we also use it for those breakthroughs that we see in patients so that we don't necessarily have to switch a biologic, because if they're doing pretty well, but just get a few breakthrough areas, this becomes effective. Obviously, you can combine it with topicals too, phototherapy, things like that. Most of my patients who are doing XTRAC have absolutely no interest in phototherapy simply because this works so much better than the phototherapy choices. It works really well for immunocompromised patients, pregnant lactating women, and pediatric patients who are not going to have the same oral or biologic therapeutic treatment options that patients who aren't pregnant or lactating obviously have, that adults have, and that non-immunocompromised patients have, or even patients with a history of cancer or things like that, where we really don't want to have to put them on an immunosuppressant. So this does open up a lot of treatment options for us. I know we are actually treating some psoriasis patients who are pregnant right now. And I've seen very nice results. We have a pediatric psoriasis patient who has really done super well with this treatment and has really kept her from needing a biologic, which her parents were a little bit more skeptical of because her main disease was really just her knees and her hands. So it's been nice to be able to use that to clear those areas, and has made the parents very happy too. This is not something that alone you're going to use for generalized disease, erythrodermic psoriasis, obviously photosensitivity disorders, or for somebody who can't commit to 2 to 3 treatments a week. And I would say 2 treatments a week seems to be the norm here. We do get some patients who are driving into my office from, northern Pennsylvania, which is about 2 hours away. This is not going to be a treatment option for them. So keep that in mind when you're assessing patients. So clinically, why the excimer laser band? 308 nanometers is a very unique wavelength of laser. It is a high intensity narrow band UVB source. So it is very targeted phototherapy. It has very high precision, repetition rate, and energy output that provide very good efficacy by causing T cell apoptosis more effectively than just sort of the narrow band UVB phototherapy boxes and stuff that we've used before. And this is a much more focused beam. So you're getting much more energy and efficacy out of one treatment of XTRAC laser therapy versus, 5 to 10 treatments of a narrowband UVB light source. Mechanism of action here mainly is through the induction of apoptosis of T cells and to a degree of keratinocytes too. So those thick psoriatic plaques start to melt away in these conditions. And you can see here, this is an example with a baseline psoriatic plaque before, during, and after treatment. And this was about 6.2 treatments to get to a PASI 75. So it works very, very well for psoriasis. This is an example of vitiligo. So we see much faster results, obviously, for psoriasis. Vitiligo patients, I do counsel them that it is going to take longer. So this is an example here with about 75% repigmentation in about 20 treatments here. This patient, after 21 treatments, had 80% facial repigmentation, and they retain that at 3 years. So the nice thing about XTRAC is, in vitiligo patients, when they get these, or even with psoriasis and atopic derm, it does seem to induce longer periods of remission, which we find to be quite different from our topical therapies, which when patients stop using them, they tend to flare up very quickly. We don't really see that with the XTRAC laser. That's probably due to the fact that it's inducing such good apoptosis in those attacking T cells in the area, rather than just kind of turning down the inflammation. It's really kind of eliminating the inflammation in that area. Now, it's not a cure, because you're going to form new T cells so they can come back at some point. But it does seem to be much more long-lasting than just topicals. And you can see for vitiligo, it can really induce long periods of remission on the face. So in atopic derm, it's decreasing both IgE and Th2 mediated cytokines. You can see here about an 81% reduction in itching within 4 weeks of treatment, and long lasting up to 26 months of disease-free remission in certain areas with no relapses. So again, not a cure, but much longer duration of action than some of our biologics. Obviously, if you stop, like, people on Dupixent, if they stop using it, most of them are going to flare much more quickly than 26 months. And same thing too with topical medications. When they stop their topical steroids or some of their new non-steroidal anti-inflammatories, most of those patients are going to flare within a month or two, if not sooner. Whereas here we're seeing longer periods of remission. So this has worked really well for a lot of our dyshydrotic patients who just are tired of topicals and don't necessarily want oral therapy, or who go on oral or even biologic therapies like Dupixent and get improvement but don't get clearance. So this has been a great way to deal with those. It's very safe and effective with minimal side effects. Blistering is probably the one common thing that we do see, and that is normal. And often leads to faster clearance. So do counsel patients that you can get a blister from this, just like they can get a blister from Naravan UVB phototherapy. And that is okay. Those blisters will heal and they will do well. And a lot of times I think it's encouraging for patients to hear that patients who do get blisters sometimes actually get better faster. So just let them understand that that's a normal thing. Hyperpigmentation and post-inflammatory hyperpigmentation at spots is very normal. It will fade over time once therapy is complete. It is safe for use in children, as I said, pregnancy and nursing, and then a lower cumulative dose compared to other phototherapies because it's very focused and very high energy at one treatment. It targets only the affected skin areas. You're not treating unnecessary areas with narrowband UVB light, which is a huge advantage over the light boxes. And it does not increase the risk of skin cancer as shown in very long-term studies. So there's no surprises coming with this. So the goal of XTRAC therapy really is to achieve the maximum amount of clearance in the fewest number of treatments. So it is important to get that first dose correct. So get that first dose optimized and then ramp up appropriately. There are very good guidelines and the nurses get trained in this. You want to actually make sure that you're following this dose ramp up to increase that by the percentages that are recommended, and to do about 2 to 3 treatments a week with at least 1 day in between. I would say most of my patients are probably coming twice a week. Underdosing is not good. It leads to poorer outcomes. It delays the actual getting to the promised land, as I say, for patients. Patients get frustrated. They're more likely to drop out of therapy, which is going to lead to more frustration for them. They're going to want to switch therapies. They're going to want additional therapies. And then it's also going to be lost revenue for your practice if they're discontinuing after you've done the work to get them enrolled and get started. So dose it correctly so that they're actually getting to the endpoints they expect to achieve. Education really is critical for success here. They need to know what to expect. So we're looking for a mild sunburn-like tenderness that fades within 24 to 48 hours. Blistering can happen, nothing to panic about. It's temporary. It will go away. Schedule 2 to 3 times a week. We make a bunch of appointments at a time. You don't want to schedule it and then, oh, call me to make another appointment, because well, that leads to is long gaps and they're not getting all those treatments close together, which is what's going to make the difference. So consistency and compliance really are essential to get those outcomes that we showed. The treatment technique here, the handpiece has to have full contact and that tip with the skin. It needs to be a uniform lawnmower-like pattern to avoid any overlapping or underlapping or skip areas, and then utilize the templates to treat various shapes and protect the healthy tissue from treatment. This is really what separates this, obviously, from Naravan UVB. You only want to treat the affected areas. You don't want to treat the normal skin. So, few consulting pros with this. Recommend this to every patient really with psoriasis, vitiligo, and atopic. I don't force it on anybody, but we do mention that we have this device to everybody. And patients do see this too, because we have video clips running in the waiting room of things like this. We have before and after pictures available. There's brochures and things like that. I want it out there so that every patient who has these diagnoses is aware of it. It is not the ideal treatment for every single patient there. But for many patients, it becomes a conjunctive therapy. For some patients, it's the only therapy they need. But for most patients in my practice, it's used along with creams and used along with biologics. Provide the relevant patient brochure. Patients love brochures. They like to be able to see what the pictures look like and take it home to their family and things like that. Submit the insurance information in the RDX for quick verifications. Most of our patients are getting qualified very quickly. We're putting in what they failed and things like that, mostly just a topical for the most part. And then get that first treatment scheduled very quickly, because after the approval, you don't want to waste time. You really want to get that up and running. So just some final points here. It's painless, safe, and highly effective. There is absolutely no downtime with these treatments. Patients can leave the office, go right back to work or go back to school, play all their sports and things like that. That has been a big concern from parents before. If they bring their child in at the end of school for a session, can they go and play basketball or play on their volleyball team or baseball team and stuff? And that is no problem whatsoever. 2 to 3 sessions a week. Try and book those in advance so that those things are in the schedule, so that you're not having trouble getting these patients in, or you lose momentum because they don't call back and then you're playing phone tag because people are so busy, their lives are crazy. You want to get those booked ahead of time. Generally really well covered by insurance. There's a copay rebate program available after the patient has done a number of treatments. I actually do like the way STRATA has set that up, because they don't get that right away. It really increases compliance so that they do those 6, 10, 12 treatments to make sure that they're getting the results, and then also that they're getting their funding back for those copay benefit program. Use it in conjunction with other topical medications and biologics. It targets only the affected areas. You're not treating normal skin, unlike other light therapies. And again, compared to all of our other, biologics and oral medications, and even many of our topicals, this is FDA approved for children. You can use it in pregnant and breastfeeding women, and it can be used in all skin types. And it's great for those immunosuppressed patients or patients who have a prior history of cancer, where biologics become a lot more challenging. So psoriasis patients here, 6 to 10 treatments is going to get them significant improvement. So they get results very, very quickly. Remember, if you're doing like we're doing about 2 treatments a week, within 3 to 5 weeks, they're getting really, really good results. 10 to 20 treatments, you can get pretty much full clearance, even for palmoplantar disease or scalp disease, which, remember, can be very, very challenging. Nails, you're going to improve very quickly, but remember, to see those results can take a little bit longer. And results really do last here about 4 to 6 months. Most patients have remission for that period of time, sometimes even longer in certain areas too. Vitiligo patients, it is best for face and neck. You're not going to get as good results over bony prominences. We had one person who wanted, elbows and knees treated. You can treat those. You're not as likely to see full results in those areas, even though you may get some benefit. About 4 weeks, you're seeing itch relief in an atopic dermatitis patient. 1 to 2 weeks, noticeable reduction in redness and skin thickening in just that 1 to 2 week period of time. So again, it really works well. You're seeing some improvement in itch in 1 to 2 weeks as well. But definitely, psoriasis, I would say, is the fastest improvement out of anything. And then atopic derm within 1 to 2 weeks, also that redness and skin thickening improvement there. Vitiligo does take longer. So just remember that. And that is all I have to go over tonight. I would be happy to take any questions that you guys have.
Thank you, Dr. Nazareth. Now we'd like to open it up for questions. If you haven't already, please feel free to submit your questions in the Q&A feature at the bottom of the Zoom screen. We got a couple questions so far. So, Dr. Nazareth, how do you determine XTRAC is the right modality with so many options for psoriasis patients?
So I look at it more as not an either this or one of those. I look at this as something I can add to it. And to me, that's kind of freeing, really, because in dermatology, so many times, we've got all these other medications, and I think we'd like to sometimes combine some of our oral therapies with our biologics, but insurance is never going to approve that, right? But this is one of those therapies that we can combine to other therapies. So we're using it in conjunction with creams. We're using it in conjunction with, Otezla and Sotyktu, and probably someday Icotrokinra as well, because we know that's going to see approval in 2026. And then we're also using it with all of our biologic, whether that's a patient who's still on one of the old, TNF alpha inhibitors, or more likely a 17 or a 23. And we're seeing very nice results with those, because It can be used, as I said, as before while they're waiting for treatment, for the breakthroughs, or if you've got somebody who just needs those little extra help at the beginning of winter or those times of year when they're more apt to flare up. And also for those vexing areas. So we sometimes do that for pommel plantar and stuff, where we found that, a lot of the biologics work well, but they don't quite get pommel plantar totally cleared up. And now, before, our patients kind of lived with that, or we kept shifting around the creams or things like that. Now we've got a way to actually clear the residual pommel plantar disease. So I invite the wealth of psoriasis treatments. I feel like we're at the tip of the iceberg for, atopic derm. We're getting more and more therapies for that. Still a bit short on the therapeutics for the vitiligo end of things, but we're going to see the JAK inhibitors coming next year. If anything, when those therapeutics come out, I actually see an increase in my usage of XTRAC, because a lot of those patients will come to my office, go on therapy, get a partial result, and now I've got a way to move them forward to get them a more complete result than if I used it alone.
Thank you for that. This next question is kind of based off building off the answer you just had, but can you walk us through your treatment protocol when you're using XTRAC conjunctively with biologics for psoriasis patients?
Yeah, so I think it's very important to, this is a patient by patient situation, because clearly we've got a bunch of different biologics and I have patients on all of them. So when a patient comes in and we're assessing, if they're a type of person, for example, that, has enough disease where I feel that they need a biologic, they've probably failed topicals before. This is a time where I'm probably going to discuss the biologics with them and add that biologic. And while we're doing the prior auth for that, I'm also going to have my team do the prior auth and submit this. Well, they're not doing the prior auth, they're just entering the information into the RDX portal to get XTRAC approved as well. Generally, XTRAC is going to get approved before the biologic is going to get approved. And we have very good biologic coordinators, but that is just a slower process compared to getting XTRAC laser approved. So we're able to get them in and start therapy on that. So they're seeing some relief even before we get the biologic approved. And then after we get the biologic approved, obviously they're going to get better. But remember, with psoriasis, sometimes 6 treatments, 7 treatments, they're getting pretty clear at that time. So it really hasn't stopped my uptake or decreased my uptake of biologic use in those early patients, but it allows me to get them to the promised land quicker. On the other end of things, we have some patients who are on biologics who were doing very well. And now, we have a particularly bad winter, or they go through a very stressful situation. We had one patient, whose mother got diagnosed with cancer. She's dealing with a lot of stress trying to take care of her mom and, taking family leave time and things like that. Very, very stressed. She gets a psoriasis flare up. Well, she's doing pretty well on her biologic normally, but she's got this flare up. I'm not going to wholesale change her biologic and start a different regimen at this time of the year when, coughs and colds and strep and, even COVID numbers in Buffalo are very high. I'm certainly not going to want to add methotrexate or cyclosporin to her biologic. So this is where I can now come in and add the XTRAC laser to her therapeutic treatment regimen to clean up those little flared areas that she's seeing, but leave her on the biologic to maybe just get her through this tough time where she's dealing with her mom being sick. So I use it in between as I'm getting the biologic approved, but I also use it during the entire journey of biologic therapy, or even in certain cases where maybe one is failing and we're bridging them to a different biologic. This becomes something that we use. The nice thing is generally the prior auth is approved for a year. So in a lot of cases, patients are getting treated up in the beginning of the year, they're getting clear. Everything's hunky-dory, now it's February, March, spring, we're good, the biologic's working great. Now it rolls around to this time of the year, and that's when the phone calls are coming in from patients who have atopic derm and for psoriasis who are experiencing flare-ups of their conditions because of weather over here. And now I can actually treat them again because their auth is still good because it was good for a year. So that actually becomes very nice to treat those breakthroughs as well, too.
Great. I can probably take this next one, but it says you mentioned a nurse is a nursing home person that can do a treatment, or can an MA do it as well? I'll take this and you can add to it if you want, Dr. Nazareth, but this is based on, it's state to state, the laser delegation laws. So it really depends, Julia, on which state you're referring to. I would just recommend looking at your laser delegation laws in your state, but do you want to add anything else, Dr. Nazareth?
I was absolutely going to say, please check with your state laws. I can tell you in New York State, I cannot have an MA do it. I have to have a nurse do it. I believe it's New Jersey that requires a provider to do it. They're the most restrictive in the country, I do believe. Most states, though, it seems to be split between if MAs can do it and if nurses can do it. But New York State, where I'm located, it has to be a nurse doing the therapy. But please check your state regulations on that one. That should be fairly easy to find.
All right, next question. How do you motivate patients to keep coming back to the office for treatment 2 times per week?
So I think that the initial thing is to go ahead and schedule, like, for some patients who are more skeptical, we try and schedule 6 treatments. So I'll just try and partner with them to do that short period of time. I'm not looking to, oh, all right, it's going to take 20 treatments to clear you. I'm not necessarily looking for that. Let's just book 6 treatments, book the next 3 weeks out here. Let's get these on there. If you're not seeing a result at that point, we can stop the therapy. I don't see that happening, though, because patients see so much improvement in those 6 treatments, whether you're talking like atopic and psoriasis, that they're very motivated to come back. The other big motivation for patients who have the copay is if they complete that certain number of treatments, they're getting those copays refunded. So to me, that has been a wonderful program to include 2 aspects of it. Number one, it's gotten patients interested in the program, because patients who have a $20 to $40 specialist copay, like, I don't know if I want to commit to doing that many treatments, if it's going to cost me that much. So having that copay assistance program has been huge for them. And number two, by making sure that they only are eligible for that after completing a certain number of treatments, that has vastly improved compliance compared to when STRATA first ran that program, I believe in 2018 or 2019, when they didn't have to complete a minimum number of treatments. This has been better because now it's improved compliance. The only one I would say where we have to work a little harder on compliance really is vitiligo. I don't have any issues with compliance on atopic and psoriasis. Vitiligo is going to take longer. Many of those patients need about a good 15 to 20 treatments before they're seeing some good results. They might be seeing something, but the really good results come in that 15 to 20, even 20 plus treatment range. So I do feel it's important to really encourage them that it's going to take time. But at the same token, patients are more motivated when they have vitiligo on their face because they really want to clear, and we don't really have a lot of other therapies. We're trying to get everybody on Opzelura, but beyond that, there's really not a lot of therapeutics that we have for those patients. So that combination of Opzelura plus XTRAC laser has been great, and most of those patients are pretty darn motivated to keep coming back.
She goes right into the next question. Have you been combining JAK inhibitors like Opzelura with XTRAC?
Yeah, I don't honestly think that there's anybody, unless we absolutely are struggling with insurance, and even then we're trying to do sampling and stuff like that. Pretty much 100% of our patients with vitiligo are getting that combination. I don't know if there's been studies to look at that, but I really do feel that, obviously we had XTRAC that we're using before we had Opzelura, and we're combining it with either, mild topical steroid or topical calcineurin inhibitors on the face. I do think, anecdotally, we get better results by combining Opzelura compared to the old creams plus the XTRAC laser. And I also think that patients who just get Opzelura don't do as well nearly as patients who get both. So I would strongly encourage people to use both conjunctively in these patients, because some of our most vocal advocates, I think you guys are aware of this too, who really wanted to have a patient named Virgil, and he wanted to do commercials for them. He did social media posts for us. He was telling everybody in the waiting room about this. He was so happy because, he was an African-American gentleman, wonderful guy, had really, really bad disease on his face. And, he had like 22 XTRAC treatments. I think we did Opzelura, and he got full facial repigmentation back. And he was a changed man. I mean, his confidence soared. He was just so happy. So I really do feel that that's a motivating force, but I do think the combination of Opzelura plus XTRAC right now is probably our gold standard for treating vitiligo, particularly on the face.
Any guidance on steps to get insurance to cover XTRAC for atopic dermatitis?
Yes, document everything you can. And, STRATA works really well with the nurses on how to put things into RDX. So we're putting in what they failed. And clearly, a lot of our atopic derm patients have very high body surface area. So if you're like, well, I'm just going to use my XTRAC laser to clear somebody who's got 90% body surface area, that's not an effective plan, obviously. So, combine it with the other treatment modalities, but, we're talking in there sometimes like, hey, patient's been on this and they failed these things before. We have these areas that we need to clean up with that. So put as much detail as you can into RDX because those things do seem to help it get approved. I will, tip my hat to STRATA's team. They've done a very, very good job with getting that approved. I think the hardest battle we probably face is vitiligo overall, which honestly has improved a lot because we had very little coverage for vitiligo back when I started in 2019 or 2018, not 9 years ago now, actually, so 2017. And now we've actually got very, very good coverage for vitiligo in my neck of the woods. And honestly, that's STRATA just really working the ground game to get insurance to cover it. And it's us kind of, taking those pictures and having the fights with insurance and showing what's possible for these patients. If you're willing to pay for an expensive medication like, Opzelura, or you're willing to pay for all those topical calcineurin inhibitors, let's show you what 20 treatments of this can actually do for those patients. And a lot of times it's actually going to save them money because think about how many less office visits and how many less tubes of cream that they're going to end up paying for because they're getting the results that they want on their face.
Definitely. How many treatments should after how many treatments should excimer laser be discontinued if no improvement with vitiligo versus psoriasis?
So psoriasis, I want patients to do about, if they can get me 6 to 10 treatments, I expect to see results by that point. So I can't say I don't see anything. Clearly, some patients get better faster than others. But most patients are getting very, very good noticeable results by 6 to 10 treatments with atopic derm or psoriasis for that matter. Vitiligo is going to be a slower process. We're really looking at about 20 to 25 treatments to see something. So, if you're not seeing anything in 25 treatments on a face, I would think that's a very rare occurrence because we're seeing something. It is very possible, though, if you're treating other areas in addition to the face and necks and chest, obviously, too. So let's say you have a patient, because we've done this before, where we're treating their face, neck, and their hands. It is often that we will see nice results, or at least partial, if not complete results on face and neck, and see very, very minimal improvement on their hands. So, I'm not going to do 200 treatments just to try and get 2 or 3% more benefit on their hands. Set reasonable expectations, really make those patients understand it's going to work very well for your face, your neck, and some other fleshy areas. We had a couple of patients with some random vitiligo blotches, in like abdomen or back or things like that, those fleshy areas. It actually works really well for those too. It's really just bony prominences like knees, elbows, dorsal hands and things like that, where it's not going to be as effective. But, if you want to set a reasonable number to tell a patient, I would say at least try and get to 20 treatments. Because, if they're just going to do 6 treatments for vitiligo, you're probably not going to see much. So it is a little bit more commitment for those patients. But by the same token, those patients have been the most willing to commit because they really don't have any other options. So it has been something where we've seen very, very good compliance out of those patients. Psoriasis, atopic derm, if you can get them to do 6 to 10, they're going to see some nice results. And now with the copay assistance program kind of getting them to that point for you, because unless they get to that, they're not getting their copays back. Compliance has been really, really great. But I still think it's important to set the expectation of when they're going to see the result.
Last question. Do you taper patients off of laser treatments?
Generally not. We have some patients, we're just cleaning up smaller areas. So, you saw earlier in my presentation that, we've got the 3 different levels based on surface area or based on code there. So a lot of patients may start, at a level 3, and then over time they're down to a level 1 because most areas have cleared up. And now we might just have 1 or 2 remaining areas that we're working on. I have one patient right now actually had some pretty significant psoriasis on, posterior scalp. She's on a biologic, doing well, tends to flare in winter. Started to flare in October here where it got a little bit colder with the nights and stuff. We treated her scalp really well. We treated her hands, and now she's literally just got a couple of spots left kind of at the thenar and hypothenar eminence there now on her hands that we're working on. So, we'll clean those up and then discontinue treatment for her, and she'll probably do very well until, maybe February or so, or we get another really ridiculous cold front here in Buffalo or something, get a little flare up, we'll treat her again. And then generally between like February and November or so, or October, we don't see her again, other than for, maybe a one biologic visit and a skin check. She won't need XTRAC again till then because she'll stay clear. Same thing for, I would say, atopic derm. Vitiligo patients tend to, I wouldn't say taper out, but they don't usually, most patients aren't going from 3 treatments a week to stopping cold turkey. They may end up doing like 2 and then 1 and then stopping or something like that. But most of it is based on the clinical endpoint, not necessarily the number of treatments per week. So if somebody's achieved the clinical endpoint and an area is clear, we're stopping therapy in that area.
Okay. Well, it looks like all the questions. So Dr. Nazareth, thank you again. And everyone that joined, thank you guys for joining us. I hope this session gave you a helpful look at how XTRAC can not only improve clinical outcomes for your patients, but also create meaningful impact within your practices. If you have any additional questions or would like to learn more, please don't hesitate to reach out to your territory manager. They'd be happy to help you take the next steps with XTRAC. Thank you all again and have a great night.
Thank you.